try right. This is Pack 365. Myself Srija. So today in this session you are going to learn about the ICD-10-CM coding classification from the code range H25 to H59, which describes the diseases of the eye and adnexa. So H25 to H28 codes. So this describes about the lens disorders, nothing but the cataracts. So the lens is a transparent structure inside the eye. So that helps to focus the light onto the retina. So when the lens becomes cloudy, it is called as a cataract, which leads to blurred vision. So this ICD-10 codes classify different types of lens disorders. So coming to H25, it is an age-related cataract. So these cataracts, they occur as a part of normal aging. So the lens proteins slowly degenerate, becoming the cloudy. So H25.0, it describes about the senile incipient cataract. So what do you mean by incipient? Means early stage. So only a small part of the lens is cloudy. So patients may have the mild blurred vision, glare at night, or difficulty in the reading. So H25.1 is for nuclear cataract. So what do you mean by nuclear cataract? The cloudiness occurs in the central part, nothing but a nucleus of the lens. So this is the most common age-related cataract. Vision becomes gradually blurred. So colors may appear faded or yellowish. So H25.2 is for cortical cataract. These opacities appear in the outer part, that is cortex of the lens. So typically this is seen as the spoke-like or wedge-shaped opacities. So vision may be worse if bright light, because the scattered light increases the glare. For example, age-related nuclear cataract in the left eye. So this is for age-related cataract. So H26 category is for other cataracts. So these are not age-related. So these cataracts occur due to the reasons other than the aging. So H26.0 code for infantile or juvenile cataract. So this is present in the babies or children. What are the causes of the juvenile cataract? These are the congenital infections, metabolic disorders, and also genetic conditions. So they need the early diagnosis to prevent the amblyopia, which is also called as the lazy eye. So next is traumatic cataract. So what do you mean by traumatic cataract? It is caused by injury, maybe a blunt trauma, penetrating eye injury, chemical burns, or cloudiness occurs due to damage to the lens fibers. So this may appear quickly or months after the trauma. So what is the example? Traumatic cataract, right eye. So this is about the other cataracts. So H27 is for other disorders of the lens. So these conditions, they affect the lens, but these are not the cataracts. So H27.0, aphakia. A means absence, phakia means lens. So aphakia means the lens is absent. So this often occurs after the cataract surgery, where lens is removed or due to trauma. So without lens, what happened? The eye cannot focus properly, right? So the patient needs thick glasses, contact lenses, or an artificial intraocular lens. So H27.1 is for dislocation of lens or ectopia lentis. So the lens shifts from its normal position. So what are the causes of dislocation of lens? Trauma, genetic disorders, or it may be due to weak or broken zonular fibers. So what are the symptoms? Double vision, sudden blur, or distorted vision. For example, lens dislocation. So on the picture here, there are three diagrams showing you the normal eye and the eye with the cataract. So the normal eye, the lens is very clear here. The light focuses properly on the retina, whereas in cataract eye, the lens becomes cloudy. So this results in a blurred, dull, or hazy vision. So there are different types of cataracts in this diagram: cortical, congenital, nuclear, secondary, traumatic, and also posterior subcapsular. So cortical means the white spokes from the outer lens, whereas congenital, it is present at the birth. Nuclear, it is central clouding. Secondary, this is formed due to medications like steroids or diseases like the diabetes. So traumatic means it is caused from the injury. So posterior subcapsular, it is clouding at the back of lens. causing glare and difficulty in the reading. And here it is a aphakia diagram. This shows an eye without the lens. So after removal, the eye loses its focusing power. So this is about the cataracts and the dislocation of the lens. So next category is H30 to H36, choroid and retina disorders. So we have already discussed about this choroid and retina anatomy in the anatomy session. So choroid is the vascular layer which lies between the retina and sclera, whereas retina, it's a light sensitive layer which is present at the back of the eye, which is responsible for the vision. So disorders affecting these layers can cause a serious, often sudden vision problems. So understanding them is important. So what is H30? Chorioretinal inflammation. So what do you mean by chorioretinal inflammation? This refers to the inflammation of both the choroid and retina. So this is commonly due to infections, autoimmune diseases and also the inflammatory conditions. So H30.0 is assigned for focal chorioretinitis. So focal means the inflammation is limited to one specific area. Okay. So H30.01 is disseminated chorioretinitis. So what do you mean by disseminated word? It means spread over many areas of the retina and choroid. So this is more severe than the focal inflammation. So this can often lead to widespread retinal damage. For example, recurrent posterior uveitis. So you have to assign the code H30.1. So next is H31 for other choroid disorders. So what does this include? Degenerative, hereditary or structural abnormalities of the choroid. So examples like choroidal degeneration, choroidal sclerosis and choroidal dystrophies. So these conditions, they may cause the progressive vision loss. So H33 is for retinal detachment and break. So retinal detachment, it is a medical emergency. So the retina separates from its underlying blood supply where the vision loss occurs quickly. So there are the three main types of retinal detachment: rhegmatogenous, tractional and exudative detachment. But there are only two important categories over here. H33.0 for retinal detachment with the break. So what does it mean? A retinal tear or a hole forms so that the fluid enters behind the retina and the retina detaches. So this is called as the rhegmatogenous detachment, which is the most common type of a detachment. So what are the symptoms? Sudden flashes of light and many floaters. Whereas H33.2 is for serous detachment. So what do you mean by serous detachment? It is also called as exudative detachment. There is no tear or no break in this type. So this is caused by fluid accumulation under the retina due to inflammation, tumors, hypertension and also central serous retinopathy. For example, rhegmatogenous retinal detachment in the right eye. So this indicates a tear-related detachment on the right side. And here at the right side, you can clearly see the picture of the healthy eye and the retinal detachment eye. So in the healthy eye, the retina is flat and firmly attached. So the light passes through the lens, focuses on the retina. So it results in the clear vision. Whereas in the retinal detachment eye, retina pulls away from the choroid. A retinal tear allows fluid to collect the underneath. So you can clearly see this retinal tear in the diagram. So what happens? What is the result if a tear is seen in the retina? It results in a sudden loss of the peripheral vision. So this is possible, if possible, the permanent blindness if it is untreated. So this is about the retinal detachment. So next is H34 for retinal vascular occlusion. So there are two types: central retinal artery occlusion CRAO and central retinal vein occlusion CRVO. So these disorders occur whenever the blood flow to the retina is blocked. So CRAO, the central artery supplying the retina, it gets blocked, usually by an embolus. So this results in sudden, painless, severe vision loss. So often described as a stroke of the eye. So in this, the retina appears pale with a cherry red spot on the exam. So this is an emergency condition. where in the case of CR-VO, the main vein that drains blood from the retina becomes blocked. In CR-AO, the artery is blocked. In CR-VO, the vein is blocked. So the retina becomes swollen and it is filled with the hemorrhages. So what are the risk factors of CR-VO? Hypertension, diabetes, glaucoma, and the blood clotting disorders. So here is a typical fundus image which shows the blood and thunder appearance. So you can see there are lots of hemorrhages in this picture. So what are the common causes of the choroid and retina disorders? Like diabetes, hypertension, trauma, aging, infections, autoimmune disorders, and also high myopia. So next, coming to H35, other retinal disorders. So these are the diseases affecting the retina, especially the macula, which is responsible for the central vision regarding recognizing faces and the fine details. So this mainly focus on the age-related macular degeneration. So what is ARMD? It is a progressive disease that affects the macula. So this is most commonly seen in elderly individuals. So there are two major types of ARMD. Non-exudative ARMD and exudative ARMD. So non-exudative ARMD, H34.31 code is assigned. So this is the most common type of ARMD. Almost 90% of cases are about this category. So it has a slow progression. So this is caused by the yellow deposits under the retina. Macula becomes thin and weak over the time. So in this diagram, the macular degeneration diagram, you can see the dry or atrophic. Here the drusen deposits visible. So retina shows thinning and there is no fluid leakage. So next is exudative ARMD. This is a less common. Only 10% of cases are seen in this exudative ARMD. This is more severe than non-exudative. So this abnormal blood vessels, they grow under the retina in this case. So these vessels, they leak the blood and fluid, damaging the macula. So in the picture, you can clearly see the wet exudative ARMD. So in this, you can see the leaked blood, the fluid collection and the swollen retina. For example, dry ARMD, right eye, is diagnosed within the patient record. You have to assign the code H35.32. So this is a normal retina diagram. It shows you a macula, fovea, which is a central sharp vision, and also normal blood supply, no deposits of fluid. This is how a healthy retina should look. Whereas in a macular degeneration, it shows the differences between the wet AMD and the dry AMD. In the wet AMD, the leaking fluid and blood is seen, whereas in the dry AMD, you can see the drusen deposits. So this helps you to visualize why vision gets blurred. So next is H42 category, glaucoma. So what is glaucoma? Glaucoma is a group of eye diseases where the increased pressure inside the eye. What pressure? Intraocular pressure. So this pressure, it causes the optic nerve damage. So why this pressure increases generally? Because the fluid which is in the aqueous humor is produced inside the eye. So it normally drains out through the canals. So if the drainage is blocked, this fluid, it builds up. Then what happens? The pressure increases, which leads to the optic nerve damage. So there are types of glaucoma. So H40.0 is for glaucoma suspect. It is assigned for glaucoma suspect. So the eye has risk of glaucoma, but no definitive damage is yet. What are the examples? High eye pressure, strong family history. So H40.1 is assigned for primary open angle glaucoma. So this is the most common type of glaucoma, the primary open angle. So what is the mechanism of this? The drainage angle between cornea and iris get opened, but the drainage channels become gradually blocked so that the pressure increases slowly over the years. You can clearly see this picture, open angle glaucoma at the right side. It shows an open angle. Here the drainage canals are clogged so that the pressure builds up and it leads to the optic nerve damage. Example, primary open angle glaucoma, left eye. You have to assign the code H40.1. So next is primary angle closure glaucoma. This is less common type of glaucoma, but it is an emergency one. So what is the mechanism under primary angle closure glaucoma? The angle between iris and cornea becomes narrow. So the fluid can't flow out. The pressure rises suddenly, which leads to severe eye pain, headache, and also nausea-like feeling. So in the diagram, you can clearly see the closed angle glaucoma. The iris is pushed forward, the angle becomes too narrow, and the fluid gets trapped. So this is about the primary open angle and closure glaucoma. So H40.5 code is assigned for secondary glaucoma. So what do you mean by secondary glaucoma? This is caused by the another condition like diabetes, trauma, steroid medications, eye inflammation, cataract complication. So this secondary glaucoma, it's a type always which depends upon the underlying cause. So healthy eye and glaucoma diagram. So in the healthy eye, the normal pressure is maintained. You can clearly see in this picture. The fluid drains properly. Whereas in the glaucoma eye, it shows the pressure buildup, the eye pressure buildup. So optic nerve gets compressed and the visual field loss occurs. So how glaucoma causes the blindness? Optic nerve fibers die due to pressure. Peripheral vision lost first and then the central vision lasts longest, and this leads in the permanent damage which cannot be reversed. So what is the treatment of the glaucoma? Eye drops. There are eye drops to reduce the pressure, laser therapy, and also surgery to improve the drainage. So glaucoma, it requires the lifelong management. So this is about the glaucoma code classification. So next, coming to H43 to H45 codes, vitreous and optic nerve disorders. So vitreous is the clear gel that fills the space between the lens and the retina. The optic nerve, they carries the visual information from the eye to the brain. So disorders of either structure can significantly affect the vision. So H43 code is assigned for vitreous degeneration, H43.0 for vitreous degeneration. So as we age, the vitreous becomes less gel-like and more liquid. So the collagen fibers in the vitreous, they can clump together. So these clumps, they cast the shadows on the retina, which is seen as the floaters. So what are the symptoms of the vitreous degeneration? Black spots, cobweb-like shapes, and moving threads in the vision. Here there is a diagram showing you the normal eye and the degenerated vitreous. In the normal eye, there is a clear pathway for the light, whereas in the degenerated vitreous, there are the floating particles which disturb the light and that results in the shadows on the retina. So this is usually the harmless, but they may sometimes lead to the retinal tears. So next is vitreous hemorrhage. So vitreous hemorrhage is assigned the code as H43.1. So blood leaks into the vitreous cavity due to the injury or disease. This leads to the vitreous hemorrhage. So what are the causes of the vitreous hemorrhage? Diabetes, retinal tear or detachment, trauma, and also the high blood pressure. So what is the example? Vitreous hemorrhage right eye is diagnosed. You have to assign the code H43.11. So in the case of the left eye, you have to assign the code H43.12. So this is about the vitreous disorders. So next is H46 for optic neuritis. So what do you mean by optic neuritis? The inflammation of the optic nerve. So this affects how the signals travel from the eye to the brain. So what are the common causes of the optic neuritis? Multiple sclerosis, which is the most common type, viral infections, autoimmune disorders, inflammation after the vaccination, which is a rare one. So what are the symptoms of optic neuritis? You can see the sudden blurred vision, pain on the eye movement, decreased color vision, and also the temporary vision loss. For example, optic neuritis right eye is diagnosed by the patient. You have to assign the code H46.0. And there are also other optic nerve disorders which are classified under category H47 code. So these are the optic nerve problems that don't fall under neuritis. So H47.0 is for disorders of optic nerve. So this is a general category for the optic nerve compression, congenital anomalies, toxic optic neuropathy and nutritional optic neuropathy. So this is used when the exact cause or type is not specified. So H47.2 code is assigned for optic atrophy. So what do you mean by optic nerve atrophy? It is meant by a permanent damage to the optic nerve fiber. So what happens when the optic atrophy occurs? The nerve fibers shrink, blood supply decreases and also the optic disc appears pale. So what are the causes of the optic atrophy? Long-standing glaucoma, previous optic neuritis, stroke of the optic nerve, brain tumors compressing the nerve and also the trauma. So here you can clearly see the picture of the optic nerve atrophy and the optic disc. So the nerve fibers get shrink and it leads to permanent damage of the optic nerve fiber. So whenever optic atrophy is diagnosed in the record, you have to assign the code H47.2. If both the eyes, you have to assign H47.20. If it is a right eye, H47.21. And if it is a left eye, H47.22. So next category is H49 to H52. Ocular motility, strabismus, refractive errors. So this slide, it explains ICD-10 codes related to problems with eye movement, eye alignment and refractive errors, problems with focusing light. So H49 is for paralytic strabismus. So what do you mean by paralytic strabismus? It means the eye misalignment caused by the paralysis of a cranial nerve. So for example, sixth palsy cranial nerve, which is the right one, the right lateral rectus muscle becomes weak. So by this, the eye cannot move outward. So eye turns inward when the muscle that moves the eye outward is paralyzed. So this results in the paralytic strabismus. So H50 category is for strabismus. So what do you mean by strabismus? It is also called as the misaligned eyes. So strabismus means the two eyes are not looking in the same direction. So there are types of strabismus over here in this diagram. So clearly see the diagram. Esotropia, exotropia, hypertrophia and hypotrophia. So esotropia, in this case the eye turns inward. So you have to assign the code H50.0 for esotropia. Then exotrophia, eye points outward. So for example, alternating exotropia. So both the eyes takes turns deviating the outward. You have to assign code H50.1 for exotrophia. Then hypertrophia means the one eye turns upward, whereas hypotrophia, one eye turns downward. So these are the types of strabismus. So H52 is for refractive errors. So what are refractive errors? These refractive errors occur whenever the light does not focus exactly on the retina, which leads in causing the blurred vision. So what are the subcodes? H52.0 for hypermetropia, which is a far-sightedness. So light focuses behind the retina. Whereas H52.1 is for myopia. It is nearsightedness. So the light focuses in front of the retina. So diagram on the right side, it shows this clearly. So H52.2 is for astigmatism. So astigmatism is nothing but the eye has an irregular curve which is causing the distorted vision. So in this diagram, you can see the normal vision versus myopia. So in the normal vision, the light focuses at one point on the retina so that the image appears clearly. Whereas in myopia, the nearsightedness, the light focuses in front of the retina, so distant objects appear blurry. So the diagram shows the clear vision in normal eye, whereas the blurry far vision in the myopic eye. So this is about the refractive errors. Next, H53 to H54, the visual disturbances and blindness. So this course describes problems related to vision quality, field of the vision and also the blindness. So what are the visual disturbances? So H53.0 code is assigned for amblyopia. So what do you mean by amblyopia? It is also called as the lazy eye. So one eye has a reduced vision even though the eye itself is structurally normal. So this is common in the childhood. So this is caused whenever the brain prefers one eye over the other. In the diagram, you can clearly see the amblyopia eye and the healthy eye. Amblyopia eye, you can find the blurred vision or the blur image, whereas in the healthy eye, you can find the clear image or the clear vision. So H53.1 code is assigned for the vision loss. So any type of the partial loss of vision which is not complete blindness. So this could be temporary or the permanent. So next is H53.4 code is assigned for the visual field defects. A part of the visual field is missing. For example, amblyopia left eye, but more commonly the tunnel vision or the peripheral vision loss. So H54 code is assigned for blindness or low vision. So blindness, both eyes, H54.0. This is a severe or complete loss of vision in both the eyes. So person cannot see or he can only detect the light. Whereas in H54.2 case, low vision both eyes. So this is not the total blindness. So person can see but a very reduced clarity even with the glasses. For example, severe visual impairment in the left eye. So here there is a picture showing you the colored blindness. So this slide has two types. So red-green color deficiency and the full color vision. So in full color vision, the normal cones are working. Whereas red-green color deficiency, the most common is color blindness. So what happens? The cones in the retina, they cannot distinguish the red and green properly. So this causes the difficulty differentiating the certain colors. So this is how the color blindness works. So next category is H55 to H59, the other eye and adnexa disorders. So under this you have H57 category code, which is pain in or around the eye. So pain originating from the eye itself or the tissues around the eye. For example, it causes infection, inflammation and also the injury. H57.1 code is for ocular pain. So ocular pain is nothing but pain in the eye. So this code is used when a patient has pain inside the eye or around the eye. So without specifying the exact disease. For example, if a pain in right eye is diagnosed, you have to assign the code H57.1. So this is about the ocular pain. So the last category of this eye disorders is H59 for post-procedural disorders. So these codes are used when a patient develops complications after an eye procedure or surgery. For example, H59.0 code is to be assigned for post-cataract surgery complication. So after the cataract surgery, the most common problem is the secondary cataract or the posterior capsular opacification. So cloudiness forms behind the artificial lens. Vision becomes blurry immediately after the surgery. So in this case, you have to assign the code H59.0. And in this slide, you can see a picture over here. So the common causes of the eye pain are listed in this. So what are the common causes of the eye pain? Stye, corneal abrasion, dry eye syndrome, conjunctivitis, sinus headache, scleritis, hyphema, cluster headache, anterior uveitis, and also the acute angle closure glaucoma. So these are the common causes of the eye pain shown in this picture. So this is about the ICD-10-CM classification for the diseases of eye and adnexa. So this is for today's session. I hope this session has helped you. So in the next session, we will be learning about the anatomy and physiology of one more body system. Thank you.